I'm on the line with Norm. Norm is a physical therapist assistant, and he is willing to share his story about working in a physician-owned physical therapy practice and some of the unethical practices that occurred when he was employed by some physicians. Norm, thank you for joining us.
Uh-huh.
So, Norm, can you tell me a little bit about your experience at the physician-owned physical therapy practice with respect to the doctors asking you to do evaluations of patients?
Well, yes, they used to basically have, at times, a physical therapist come in maybe 3 hours, 2 to 3 days a week and do evaluations, and then I would end up having to treat the patients from then on, and pretty much all the time. The therapist really very rarely, if anything, ever checked back with the patient. And at times when they were short that therapist and he wasn't on staff, it was many times where they asked me to do an evaluation and treatment and try to postpone until maybe a therapist could go and look at them. But they wanted to get the patient started ahead of time and would try to get me to do the evaluation.
Okay, so to be clear, then you were evaluating patients without a physical therapist present.
Yeah.
Okay. And then in our previous discussion, you mentioned that you were, instead of a physical therapist being there to supervise you some of the time as well as some aides, can you tell me about your supervision of aides without a physical therapist being present, period?
Yeah, I mean, we had aides there at the facility, and they would be there to help out and would ask, they would have me. Again, the PT wasn't present most of the time, and we had aides on staff working at the facility. Anything from preparing, treatment modalities for patients to, I tried to be as ethical as possible in my respect of just trying to limit or basically trying to not have them do patient care. But again, it was kind of like they were trying to push me to use the aides rather because they didn't want to use a therapist on staff. And eventually, through my pushing a lot, they basically conformed and ended up after over a year finally hiring a PT for their staffing. But it was, they just constantly were trying to get me to do things outside of my realm of what I should be doing. You know what I mean?
And why did you think that was the case, that they were trying to get you to do things that you weren't licensed to do? Was it did you feel they were doing that for the best because they were concerned about the patient?
Probably
or
part of it was mainly just the doctor wanted certain things done, get as many patients in as possible, and they wanted to obviously utilize me rather than paying a therapist more hours or something, because of the cost measures, I think. And then, sometimes they were just hard to find a PT or staffing to fill the position, but they wanted to continue to make sure and get patients through.
So then it sounds like they were driven by profit rather than following the proper regulations with respect to delivering care.
Yeah, I mean, that's what I could perceive. Yeah.
Sure. And I think along those lines, you mentioned that these doctors, again, combining with our current point that they were more concerned about profits than proper patient care. You mentioned to me that that regardless of your expertise and your input with respect to discharge, the doctors would continue to have the patients come in for care when you felt they didn't need it. Can you expand on that a little bit?
Yeah, I mean, I would, me or in conjunction with the therapist when I had them, would find that the patient had kind of plateaued and wasn't benefiting from therapy anymore, and we would try to discharge the patient, but the doctor would, or either the office manager or the doctor himself would basically say, we need to continue with treatment care on that. It was kind of out of our control to some extent because they would basically just push the issue of we need to continue to see the patient.
Sure. So, Norm, about how many patients would you see in a typical day or week in this practice?
It would average, like for my schedule alone, would be anywhere between 20 to 30 patients on average. I would complain about how many patients I'm seeing, and and they would try to have an aide basically. Well, you can have the aide help you, with patient care.
Okay.
But again, a lot of times there was no PT on staff, so it was difficult for me to use an aide.
Sure, aides have no training other than what they learn on the job. So just to confirm, in a typical 8-hour day, you would see 20 to 30 patients, and there was no therapist there on staff to help you, and you could only rely on an aide or two to support you. Is that correct?
Yeah. It's just the quality of care is what I was trying to point out in that respect. It was just that's what propelled me to leave that practice, because of the unethical practices that I was kind of working under.
Understood. Well, thank you for spending your time with us and sharing that story. It's much appreciated. I'm sure this actual personal story that you're sharing supports what the evidence, the large studies out there are concluding, that in a physician-owned physical therapy practice, 91% of the time, care for Medicare patients, for example, is substandard, and it's primarily done for profits rather than what's best for the patient. Would you agree with that?
Yeah. Oh, absolutely. Yeah.